Hello, I'm Michael Horowitz, Chair of the Pandemic Response Accountability Committee. The pandemic changed many aspects of our lives, including how we visit the doctor. Reliance on telehealth services, that is medical care we receive remotely via our phones, tablets, or computers, skyrocketed during the pandemic. Today, we released a report that looks at the expansion of telehealth services across 6 federal agencies. Telehealth allows providers to evaluate and treat patients at home and elsewhere without the added risk of transmitting COVID-19. And patients, particularly those in vulnerable populations, are able to access healthcare despite the severity of the pandemic crisis. But just as any federal program is at risk of fraud, waste, and abuse, telehealth programs administered by federal agencies aren't immune to these risks. Telehealth is part of our new normal. Our hope is that agencies, policymakers, and stakeholders can use the insights included in this report to inform future decisions on telehealth and protect against waste, fraud, and abuse. We learned that telehealth presented certain advantages, including promoting continuity of care, access to care, community safety, and potential cost savings. Both the Bureau of Prisons and the U.S. Marshals Service increased their use of telehealth during the first year of the pandemic. However, telehealth use was still limited to small fractions of prisoners. We also learned that BOP and the Marshals Service do not have policies specific to telehealth. And we found that both components have blind spots in available data that affect their ability to gather a full picture of telehealth use and costs. Separately, my office previously identified concerns with the BOP's lack of oversight of costs billed and paid for contract medical services. We believe that both components should conduct additional research and strengthen their collection of telehealth data to inform their use of telehealth and safeguard program integrity.
Understanding the effects of telehealth expansion on federal healthcare programs, patients, and providers during the COVID-19 pandemic can help mitigate risks as telehealth becomes a regular part of our country's healthcare system. By understanding and taking action on fundamental issues now, like improving the data available on telehealth services, the benefits of telehealth can be realized well past the end of the public health emergency. Our work highlights how telehealth helped increase access to services during the first year of the pandemic, while also providing in-depth insights on program integrity risks. We have learned important lessons about the benefits and risks of telehealth, lessons that can help policymakers and others as they consider the future of telehealth in HHS programs.
The Department of Veterans Affairs has a long history of delivering clinical care outside of the traditional exam room setting. The pandemic certainly stressed all healthcare systems. VA made a noticeable effort to further expand telehealth services to provide continuity of care while protecting veterans and staff. Similarly, VA expanded the kinds of care veterans could access via telehealth from community providers during the pandemic. We are proud of our oversight work that reviewed the use of telehealth to care for our nation's veterans. We recognize the efforts of clinicians to meet veterans' healthcare needs and hope that our findings will further support their efforts while reducing risk, introducing efficiencies, and improving the telehealth experience for veterans and their caregivers.
Labor OIG would like to thank HHS OIG for the opportunity to participate in this program review. It was a chance to review the workman compensation program as it relates to telehealth. One of the things that the department did was quickly updated its policies to expand the use of telehealth in its worker compensation program, thus allowing the sick and injured workers to receive much needed medical care during the pandemic. We saw a dramatic increase in the use of telehealth as claimants used 34 times more telehealth services than the previous year. We also learned that there are certain risks associated with telehealth. For example, medical providers could bill for services not rendered, or they could provide more expensive services than they actually rendered. As such, it is important for the Labor Department to ensure it captures appropriate information to be able to accurately identify and monitor telehealth services being provided to claimants. Again, thank you to HHS, and we look forward to other opportunities that we'll be able to collaborate.
I'm Krista Boyd, the Inspector General for the Office of Personnel Management. OPM-OIG evaluated telehealth with regard to the Federal Employees Health Benefits Program. We found that enrollees' telehealth utilization increased dramatically from approximately 1% pre-pandemic to approximately 40%, while telehealth spending increased by approximately 6,000%. Increased utilization brings new areas of risk. We found that the burden is on enrollees, not health insurance carriers, to identify quality of care, privacy, and suspicious billing practice concerns. Accordingly, this report includes several suggestions for program integrity improvements. I want to thank the OPM-OIG Office of Audits team for their outstanding work on this product.